Hello, friends. Welcome to the Ancient Health Podcast, where East meets West. I'm your host, Dr. Chris Motley. Today, we have a very special guest all the way from Germany. She's in Germany doing some amazing work over there. She's from the States. Her name is Dr. Laura James, and she is an integrative oncologist. And she works with women that have had breast cancer. She's worked with cancer for a number of years. Doctor, we love that somebody that's going into the field and has insight and specialties in this area, because I want to know more, and I know the people out there do. So thank you so much for joining us today.
Well, I'm really happy to be here. Thank you for accommodating my schedule. It is a 6-hour difference from the East Coast, a 9-hour difference from the West. And that means I have to stay up kind of later in the day to do my job. But I'm happy to be here.
I'm so thankful. And it doesn't bother me at all when we were talking about possible guests that would come on and your name came to the surface. Let's work with anything she can do. And I actually like doing earlier podcasts, and it helps me just get the motion going. So I always ask, like, you're in Germany. I know that you told me you've done like 12 podcasts in the last months. It just shows how important your message is. And I can tell that your heart's in it. And I really am thankful for that, because, like in the Chinese medicine world, we always look at individuals like their personality and their facial features. And I know you have passion behind it. So before we start into, talking about cancers, and tell us about yourself, like where are you from, or tell us about your practice. People want to know.
Sure. So originally I'm from the East Coast. I grew up in New England, went to college in Boston. And when I was 23 years old, I decided to pack my Honda and drive west. And I developed a life in the Seattle area in the early 1990s. And that's been where I have been for all these years. I really started out my career as a writer. And I was a medical writer for 8 years before I decided I wanted to go to medical school. And it honestly took me a year and a half to decide, do I want to go to conventional medical school, or do I want to go to naturopathic medical school?
Mm-hmm.
And I ended up choosing naturopathic medical school because there was such a focus on nutrition. Mm-hmm. And in the early mid 1990s, there were no conventional medical programs that had anything more than like a long weekend in nutrition. And I thought that was really criminal. So, between having had nutrition have a really big impact on my own health as a young person, and being attracted to botanical medicine, plants are so cool.
Yes, they are.
So cool. And they are medicine. And, I had the opportunity then to go to naturopathic medical school and develop craft in nutrition, in botanical medicine, in all sorts of alternative and integrative therapies. And I tend to be an outside the box person. And so naturopathic medicine has been a really good outside the box place for me. But I've developed a career in what's called integrative oncology. And so I work with women who are going through breast cancer while they're going through conventional treatment. And I try and bring what can we do naturopathically and supportively through that process, and then help women get better when they're done with conventional cancer care. So that's truly integrative oncology. And I've gravitated towards working with women with breast cancer because I'm committed to women's health. And if you look at sort of the spectrum of women's health, breast cancer like covers it all. And so for this particular, group of women who also in many cases end up feeling like the medical system just drops them after they're done with their conventional care, a provider like me is sort of like a primary care, women's health doctor with a cancer filter in place, because I know what these women have gone through, right?
Yes.
So I often work with women for 20 years.
Wow.
Once they have breast cancer, and then they just stick with me, and, we just go through life, right? Because it's not always the breast cancer that's going to kill them.
Oh, I mean, I love that you said how you love plants and how they're awesome and you dealt with it. Now,
Yes.
when you started to work with the breast cancer and the individual with breast cancer,
Hmm.
did you find that you were naturally like drawn to it or because you saw it or it came to you? Like, I love to hear about this. Like, how did you get involved? Like, was it
Yeah.
something that you think this universal energy was like, okay, you need to deal with this, or
Yeah.
you just like this is neglected in the culture today?
I love that you bring up that universal energy because I call it an intuitive hit. You
Mm,
know,
mm,
we as humans, if we're open to the universe, we can experience this very profound, intuitive experience that often guides us, right? And you can
yes.
call that whatever you're going to call it. I call it an intuitive hit. And in my personal life, I've had a couple instances where the universe has like slapped me upside the head and said, if you don't do this, you're going to regret it, right? But with, in my career, I started out the way many young NDs start out, where we want to help the world, number one.
Mm,
And number two, we really want to help people with chronic illness, because
mhm.
chronic illnesses are not well supported in conventional medicine, right?
Yes.
um,
Yes.
and you name it, you name the chronic illness, and there's a deficit there in
Mhm.
conventional medicine. And naturopathic providers do really, really well with chronic conditions
Yes.
because we're looking for the root cause, right? And I ended up in a clinical situation with a colleague who became my dear friend and mentor, who was already working in the cancer field, and
Mm,
she kind of took me under her wing. And one of the very first patients that I had, a woman with breast cancer, was my age at the same time. So we were the same age. I was 37 years old.
mhm.
And this woman was pregnant with breast cancer.
Wow.
And it was her third child. And she was very committed to keeping the pregnancy,
Mhm.
but she had breast cancer, and she had her breast cancer diagnosis first, and then she found out she was pregnant.
Oh, heavens.
And it was a time in medicine where there really wasn't a whole lot of clinical data
Mhm.
regarding how to treat a woman with breast cancer, who was pregnant. And I was honest with her. I was young. She was one of my very first breast cancer patients, and I said, I've not been in this situation before.
Mhm.
And she said to me, I'm choosing my team. I have my plan. I want you to be on the team.
Mm,
And I was like, all right, I'm going to bust my butt for you.
mm,
And it was this incredible opportunity. It was this incredible level of trust and
mhm,
her vulnerability in what she needed.
mhm,
And I had conversations with her that were so juicy and meaningful.
mm.
And I was like, I came away from that experience like, damn, these are the people I want to work with, because you get to the heart of it so fast.
Mm, mm,
And long story about her, but she ended up developing her own path. She really kind of upset her conventional team in many, many ways, but she did incredibly well, gave birth to a healthy child who's like 20 now. And she's doesn't have recurrence. So it was a success in so many ways. And I walked away from that clinical experience and I was like, I want to work with these people. This is what makes being in medicine worthwhile.
wow.
And that's how I got into it. It was really chance. It was really luck. I wasn't looking to go into cancer care. That wasn't what I set out to do. But that's where I am. And that's where I can affect some change.
Well, it's definitely, I mean, basically just seeing that you are helping individuals so much. And when these intuitive hits come, you're seeing this momentum.
Hmm.
What there's a prevalence, I believe. I don't know the statistics. You over the years, you've seen it. Have you seen it grown like breast cancer, or what's
Oh yeah.
like the numbers or the prevalence occurring?
Well, the prevalence is 12.5% of women in the United States receive a diagnosis of breast cancer at
Whoa.
some point in their lives. So you can do the math on that, right? I
Yes.
mean, there are how many gazillion women in the United States? It's something like 1,000 women a day are diagnosed with breast cancer. It's huge.
1,000 a day.
I think that's the number, but for sure, it's a 1 in 8 chance. So if you think about a round dinner table, you go to a fundraising event and you're seated at a round dinner table with 8 spots,
Mm-hmm.
one of those women will be diagnosed with breast cancer,
Whoa, my
right?
goodness.
So
My goodness.
it's a huge number. And we have to, though, separate out a little bit, just a
Mm,
little bit to be technically accurate. There are stage 0 breast cancers, which are called ductal carcinoma in situ,
mm.
DCIS,
Okay.
and those are curable,
Okay.
curable.
They're curable. So if they get it, they can get there's hope in there. Okay.
Exactly. But those are being diagnosed in addition to the stage 1 through stage 4 breast cancers.
Oh, okay.
So it's a really, really big number, but
Mm,
a percentage of them are these curable breast cancers. And
mm,
stage 1 to stage 4, they're it's a very individualized kind of diagnosis and process and outcome. And,
mm.
the there's so many variables. There's
Yes.
so many variables, right?
Yes.
But it's a huge number. A lot of women are affected, and what we're seeing more and more is
Mhm.
that younger women are affected. Women in
Really?
their 30s, and the youngest woman I've ever treated was 22.
Wow. 22 at
Yeah,
that
and
age.
and
Are you
she had a genetic predisposition,
Yes.
but genetic cancers are only between 7 and 10% of the whole of all those women who are being diagnosed. Less than 10% actually have a gene that we can find, that we can test
Mm.
for, that is the reason for their cancer. The other
Wow.
90 to 93%, we don't really know
That's what I
why.
was gonna ask too. I mean, I
Yeah.
know it's very hard to say like this caused this.
Mhm.
With your years and experience, did you find like was there relationships to the individuals who did have cancer? Did they have a prevalence of like some kind of toxicity, or it was, of course, food? What's like the one of some of the major themes of like that could be contributing to the breast cancer?
Well, this is where it gets big and it
Mm,
gets sort of overwhelming in some respects because I'm going to get a little scientific. Let's talk about this gene issue, right?
okay. Okay.
So, 7 to 10% of breast cancers have an identifiable gene as the cause. And the
Mm,
most famous gene is BRCA1 and BRCA2, right?
mm,
BRCA1, BRCA2, those are the most famous. There are other genes that nobody really knows, a whole lot about, but they're there and they get tested for in a lot of cases. So, for the women who have that distinct genetic picture, they have oncogenes. They're called oncogenes,
good
cancer
genes.
genes, cancer causing genes, right?
Mm,
And all different cancers have some kind of oncogene associated with them.
okay.
Um, those are the genes we know, right? Those are the genes that modern medical science has shown to be cancer causing genes.
Mm,
However, two other factors. There are parts of genes, other genes, detoxific genes that play a role in detoxification in the liver and in the kidney, other genes in the body that have maybe little genetic changes. And
mm,
those little genetic changes can cause things to go faster, things to go slower. I'm talking about metabolism. I'm talking about how detoxification happens. There are all these different physiological processes,
yes.
right?
Yes.
And so, in some cases, there can be smaller changes in the genetic code
Mm.
that can lead to things like a woman having an extremely high level of estrogen in her body because her body doesn't process the estrogen well. Does that make
Wow.
sense?
Yes,
Right?
totally, totally.
So that's a potential example that has, sort of genetic code at the base. But the other thing that's really interesting and actually
Mhm.
answers your question is the field of epigenetics, which I'm
Mm.
sure you've heard of, right?
Yes,
So
yes.
epigenetics is really the environment that your genes are surrounded by. And
Mm.
there are these little proteins called histones that are
Mhm.
on the outside of your DNA, of your double helix, that
Mhm.
are kind of like on and off switches. And we're not 100% sure what turns them on, what turns them off, but
Mhm.
we do know that things like hormonal influence, toxic elements, things, pollution, smoking, those kinds of toxic things, plastics, microplastics, all that kind of stuff, nutritional influences like really high blood sugar, inflammation, those kinds of things affect those histone proteins and turn them on, turn them off, which means the genetic code is being turned on, turned off, right?
Wow.
So there's this whole field of epigenetics that's
Mhm.
really in its infancy.
Mhm.
There's this whole field of looking at what's called single nucleotide polymorphisms, these tiny little changes
Mhm.
in genetic code that's also in its infancy. And I have to say, naturopathic providers tend to be about 30 years ahead of everybody else. So,
Yes, I love
right?
this. I love it.
So,
I'm
like, a
writing this
lot of
down.
this we were talking about 30 years ago. And now everybody else is catching up. Um, but if you think about, like, all right, I've got these little on and off switches in my body affecting my genetic code, affecting how my genes express something, how my body metabolizes something. Maybe there's something I can do that's going to have positive change on that.
Wow.
And that's where we get to detoxification, nutrition, stopping smoking, stopping drinking alcohol, stress management, hormone balancing, all those pieces.
Wow. So you have the epigenetics, the external environmental um,
Right, right,
stresses. When
right.
somebody comes in and they have like stage 0, 1, 2,
Right.
3, they have those. The individuals out there listening, would there be like in your like synopsis, your intake,
Mhm.
and you go through an intake and you try to find out the levels of certain things like how much caffeine or how much alcohol,
Right.
and so you go through because you said naturopath is 30 years ahead, and I agree because most brilliant doctors I know are the naturopath. And do you find, and maybe this, I don't want to go onto a rabbit trail, I'm saying with that intake, do you find like certain deficiencies, like a question, like you ask a person with breast cancer, say, this is the major deficiency I see in your profile. And it like, it is affecting a lot of the people with breast cancer, like they don't have enough, hydration. Is there something that you see it's really prevalent?
That's a really good question. In a perfect world, people would fill out all their paperwork before they come to see me. Number
Yeah.
one. Number two, right? Number two, in a perfect world, I'd be able to do all the kinds of tests that could really give us a lot of information.
Hmm. Hmm.
And, I try really hard to make what I'm going to suggest for people affordable.
Hmm.
And sometimes these specialty tests can be really unaffordable.
Hmm.
And like there's a genetic test that I like to use that looks at these single nucleotide polymorphisms.
Hmm.
And the good news is you only have to do it once in your life because it's genetic information.
Hmm. Hmm.
But the bad news is it's like $575, and so not everybody can afford that. And so, in a perfect world, I'd have a ton of information to sort through. And for the people who want to go there, that's what we do.
Yes.
For everybody else, I have to rely on blood tests that insurance will cover, or
Mm.
blood tests that are inexpensive, that kind of thing. Diet diaries, personal recall, all that kind of stuff, right?
Mm-hmm.
And so we sort of do our best, we
Yes.
do our best.
Yes.
So the deficiency question, I think there are chronic deficiencies for women across the board, like probably magnesium and different B vitamins and that sort of thing. But is there a direct relationship with cancer development? No. I think the
Mm-hmm.
biggest issues that I see as leading towards cancer development are um, high blood sugar, high levels of inflammation. And by high blood sugar, I don't mean a spot glucose done in a comprehensive metabolic panel by your primary care physician. I'm
Mm-hmm.
talking about a hemoglobin A1C level, which is a measure of a person's blood sugar over a 3-month period of time,
Mm-hmm.
because it actually looks at the red blood cell that has a 90-day life and
Mm-hmm.
how much of a sugar coating there is on the red blood cell. And I
Wow.
always tell patients, like, if you can imagine, what the top of creme brulee looks like?
Yeah.
Like if you order creme brulee in a restaurant, the top of creme brulee, that sort of netted, sugary, caramelized crust,
Oh
that's
yeah.
what happens to your red blood cells.
Wow, that is a great analogy.
It's a good image, right?
It is. Like I'm seriously, doctor, I'm just
Yeah.
like okay. Do with the I'm serious, like creme brulee, do they, when you see like, higher blood sugars, you're seeing these imbalances. Do people have do women have like specific signs and signals and they can get the diagnosis? Like what are the blood marks? Like you say the high A1C, are there like symptoms or physical traits that you would tell to a woman like you need to go get checked? Like cuz some people say they don't even look into it.
I think, the thing about breast cancer, that's tough,
Mhm. Okay.
is
Yes.
that the majority of breast cancers can take like 25 years to develop.
Mm. Yes.
So it takes a
25.
really, really long time for there to be enough breast cancer cells for it to get picked up on imaging.
Wow.
And the best imaging we have is mammogram. And there's some pushback on mammogram because people have various opinions about mammogram,
Mhm.
and
Mhm.
it is the best screening technique we have for the population, right?
Yes.
It's the
Mm.
best screening that we have for the population. It's not perfect. It misses things. It causes callbacks, which end up being, not cancer. They're problems, but it's the best thing we have. And
Mm.
women get scared about radiation exposure with
Mhm.
mammogram.
Mhm.
And I will tell you that the amount of radiation that is emitted in a mammogram is no more than if you were to fly on an airplane.
Heavens, I did not know that. Literally the same amount. Wow.
So it's a very small amount.
Mhm. Mhm.
So I always recommend mammograms, but you can have mammograms every year and still not have a breast cancer show up for a long time, because it is so many breast cancers are slow growing,
Mm. Mm.
and very, very dense breast tissue, which is what we find in younger women.
Mhm.
Younger women have denser breast tissue. If there's a tumor there, it could not be seen in some cases because it's hard to differentiate that density from something that might be suspicious, right?
Definitely. Do you find that there is something happening in our culture today that the younger individuals have the denser tissue? Is it like, is there a cause for that?
It's mostly more levels of estrogen.
Mm.
And yes, actually,
Yeah.
plastics are estrogen disruptors, right? So
Mm.
plastics that aren't BPA free.
Mhm.
Um,
Mhm.
BPA is a known estrogenic compound.
Hmm.
Phthalates, which starts with a pH.
Yep.
Phthalates are estrogenic compounds. And so if you haven't gotten plastics out of your kitchen, get plastics out of your kitchen. Use glass, invest in glass containers for your leftovers. And something just came out this week about takeout, like plastic takeout containers,
Yeah.
causing an elevated incidence of cardiovascular disease. Who knows about that? I would expect it to be more what's in the plastic containers that people are eating that would have the incidence of cardiovascular disease. But plastics in general are going to take over the world and end up in our bloodstreams, right?
Oh my goodness.
They're in
And
our bloodstreams.
it's doctor, it's like it's building up in the tissue because it's like they're
Mhm.
mimickers, so they build up, and then you get a
Right,
younger generation with the
right.
thickening of the breast tissue.
Well,
Wow.
it's also it's this estrogen disruptor idea. So, the
Yeah.
plastics come on board, and the plastics themselves are a toxic element, in general.
Mm.
But certain plastics have this estrogen disruption piece to them. And so that mostly leads to a heavier estrogenic burden for women in their bodies as a whole, and that can lead to denser breasts, but dense breasts in many ways are normal for younger women. But we see reproductive changes. We see just we see really heavy periods, endometriosis, those
Mm.
kinds of things. And we can test for the plastics. We can test for hormones and what they should look like. But not all young women have have dense breasts. It's
Mhm.
just younger women tend to, and older women, less so. But it's more of it's just harder to see what we're looking at um,
Mm.
on mammography with
And that's
that.
like the to be able to identify it is like the one of the biggest challenges
Yeah.
that you're seeing in our
Mhm.
culture. Do you
Yeah.
and I don't want to sidetrack on that, like, but you said, remember the A1C, and I hope
Yep.
this is not going too far from that. Like, if you have dense breast tissue, is there like also additional, like, there's very low rate amount of radiation they're saying from the mammogram,
Mhm.
and you said like sugars creme brulee. That's in my head. Doctor, that's the best thing I've ever heard. Like, I'm serious. Um, but are there times like you think that sugars could be feeding like, fungal and such, and not saying it causes like breast cancer, but could it cause higher inflammation in these individuals? Are you seeing, does that have any effect on it?
Yeah, and I mean we're kind of talking about two different issues with
Yes.
dense breasts. That's kind of one issue, although inflammation can play a role with that density. Um, and high blood sugar also has a correlation with inflammation levels.
Got you. Got
And inflammation can be caused by, so many different things.
you.
So there's not really one avenue that we can go down. That's where the whole symptom picture, the whole
Mm,
person, the personalization really comes in. But, I look at diet, how inflammatory of a diet is somebody on?
mm,
Is somebody consuming or engaging in things that are naturally inflammatory, like smoking, like drinking, like, doing whatever?
mm.
And what's their toxic profile? I
Mhm.
mean, I've had patients who work in industries where they're exposed to all sorts of stuff, you know?
Yes. Yeah.
Um, and so, a really good intake, a really thorough intake to put all these pieces together helps to lead us down somewhat of a treatment path. If I could say I knew where cancer came from, I'd have a Nobel Prize, right?
Yeah.
And I can't say that, but I
Mm.
can talk about the environment that is hospitable to cancer cells,
Ah,
right? We
oh,
want to
yes.
make that environment less hospitable to cancer cells,
That's
right?
amazing. That's it, right? True. So let's say, like, you're right, like you know the environment that can create the cancer cells. Somebody does come to you, and unfortunately may
Mhm.
have cancer.
Right.
Um, can we switch like to like the protocols? Like you're saying, like put them on a diet. Do you have like a basic protocol, or individuals out there listening are like, what are some of the things that you would recommend to your patients? Like, I would avoid
Sure.
this, I would do this. Like in your protocol, what's your basic approach? If that's too
Yeah.
broad, I'm sorry, doctor. I mean, but
Yeah, yeah,
just
yeah.
give us some basic.
No, it's, I mean, so just to differentiate, I mean, I've really honed in with my career at this point on helping women with breast cancer.
Mm-hmm.
Other people with other types of cancer, I mean, I've treated people with other types of cancer, for 23 years as well. But
Mm-hmm.
um, sometimes the recommendations will differ,
Mm-hmm. Mm-hmm.
and the course of treatment is going to be very different. And so, the I enjoy working with women right at the beginning of their diagnosis,
Mm-hmm.
because I mean, I work with people at any point in time,
Mm-hmm.
but if people are able to come to me when they're first diagnosed with breast cancer, there's so much that we can do, and we have, ground zero. We're right at ground zero. Um, but it's phasic. And
Yes.
so there are different phases of the treatment, of the conventional treatment. And then, after, survivorship is its own series of phases, but it's more kind of one big phase. So for someone who's initially diagnosed, generally what they're looking at is surgery.
Mm-hmm.
And so at least my dietary recommendations for surgery are increased protein, like really high, because you're going to need to be rebuilding healthy tissue.
Mm-hmm.
And I prescribe some herbs and some, homeopathic arnica to decrease bruising and swelling. That's the only homeopathic I use like ever in my entire practice. But, herbs that are going to help with healing. And then if a woman is looking at chemotherapy, the recommendations are different, because the chemotherapies may be different depending on the diagnosis. So, breast cancer is really like 70 different diseases. There are all these different pieces to the breast cancer puzzle:
Mm-hmm.
stage, pathology, receptor positivity. There are all these different things. And so different chemotherapy regimens are recommended. And a woman may choose not to do chemotherapy, and that's a whole nother kind of ball
Wow.
of wax, right?
Yes. Yes.
But chemotherapy, I generally tell people, do your best, but all bets are off.
Mm.
Nutritionally, I never want a woman to feel like, especially when she's dealing with a heavy duty disease like breast cancer, I
Mm-hmm.
never want a woman to feel like she's not doing well enough, like she's failing. I don't want
Yes.
her to feel like she's failing,
Yes.
um, because there is no failing. There's like being human, right?
That's right. That's right. And
Right. And when
that's
you're going
totally
through
right.
chemotherapy, all you can do is be human. And so if you want to eat donuts, like, eat the donut. Um, I mean, really, like, so many women struggle with nausea and vomiting, and I always recommend acupuncture.
Mm-hmm.
95% of the patients that I see, I send them to acupuncture. Acupuncture, it's my biggest regret in my career, is that I didn't get my acupuncture license. Um,
Oh.
but, and now I'm too old to go back to school. But, you know, I think acupuncture is so great for helping with nausea, vomiting, fatigue, hot flashes, especially electroacupuncture,
Oh yes.
peripheral neuropathy, all of it, right?
Yes.
So with chemo, it's just so hard, and you never know. Like, are women going to do really well with chemo and not have a whole lot of problems, or are they going to have a really hard time?
Yeah.
And so dietarily, I just tell people, do your best. You can put a lot of nutrition into a smoothie.
Mm-hmm.
I usually recommend whey protein,
Yeah.
because it's assimilable, and actually, whey is supportive of the immune system. Not
Mm-hmm.
everybody can tolerate it, but like, sometimes the other proteins are not as assimilable. But you can put all sorts of good stuff in a smoothie, a lot of
Yes.
good nutrition, right?
Yes. And
And if there are supplements, you can break open the capsule and dump them in.
and
So
people would do that with that nausea piece. I understand that too, because when you're having to take so many medication or I mean pills and supplements. I totally agree
Mhm.
with that.
Yeah.
When you
Yeah.
see that, like with the amount of nutrition, are there particular herbs? And I'm not saying people who are listening go out and grab these herbs and just start
Right.
taking them, but have you found like
Right.
there's some good herbs that you find that help? I know there's different phases too within the
Right.
treatment, but are there
Right.
some good herbs that you would say like these are ones that have found that worked really well with during phases of cancer?
So, yeah, I mean, it sort of depends on where a person's at, but
Mhm.
really the couple of natural compounds is what I'm going to call them.
Mhm.
The primary natural compounds are again sort of addressing this biochemical terrain, right? This we want the body to be inhospitable to cancer.
Mm.
And so, what helps the body be inhospitable to cancer? So, dietarily, right? We want to control blood sugar. We want it to be an anti inflammatory diet. We want there to be a lot of plants, those sort of basic things. But other compounds are going to be things like curcumin, which is the active ingredient in turmeric, medicinal mushrooms of various types, like Coriolus versicolor, which is more traditionally known or commonly known as turkey tail mushroom,
Mm.
reishi mushroom. I mean, you might know that 25% of the cancer treatment budget in the country of Japan is designated for medicinal mushroom use with cancer patients. So
Really?
medicinal mushrooms are incredibly integral to the immune system, to tolerance of chemotherapy. There multiple different mushrooms and multiple different ways to use them, but they're generally safe. Generally, there certainly are those anecdotal pieces of evidence that throw everything into a tailspin and make conventional providers say, don't take anything, and that is always hard to handle. But there's some really good quality brands out there
Hmm.
for medicinal mushrooms. I'm not a big fan of like Chinese style teas. I just think those are really hard to tolerate.
They're very, the taste is a little bit off, but I'm with you because a lot of patients do rather would take like the mushrooms and the
Yeah.
capsules instead of
Yep.
taking the tea. They're like, Doc,
Yep.
I can't do that. I'm
Yep.
like, yeah,
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 exactly.
tough. Yeah.
Exactly. So the other one that is really really important is green tea extract. And
Mm.
people say to me, "Can I just drink green tea?" And yes, you can absolutely drink green tea, but to get the therapeutic dose of the active ingredient of green tea that's actually going to work at the level of DNA repair,
Mm.
you have to take it in a capsule. And the active ingredient is called EGCG, and it comes from green tea. And green tea I'm drinking green tea right now, actually. Green tea
Yes.
is an amazing food medicine. And, that's the other piece is I would rather people spend their money on good quality food than on a whole slew of supplements that have dubious effect,
Yes.
right?
That's right. That's
You
right.
know?
That's a great point. Yeah.
So like buy the good produce, buy the organic chicken, drink the good quality tea,
Mm.
and ask your naturopath about the supplements that you might have in your closet.
The
'Cause half
pantry.
of them are probably like, not doing a whole heck of a lot for you.
Yes, I mean, and I'm so just so astounded too about like how much Japan uses the medicinal mushrooms because
Mhm.
I'm thankful I've seen a few patients that have had working with doctors that are, for their cancer, and
Mhm.
they are putting them on turkey tail, and they are saying how much inflammation was reduced because of the scavenging effect of it,
That
which was
too.
really
Yeah.
impressive.
Mhm.
And
That too.
that's a great point. And Doc, you pulled up, about being human. And what are the emotional effects like that you have seen with your patients? I mean, that's got to be a big part. Do you think that emotions have
Really.
an effect on a person for cancer, or
Mhm.
can it create these environments where cancers could thrive? Have you seen that?
Absolutely. Stress creates toxicity,
Mm.
period. Um, However, again, because I am very, very conscious of the woman's experience in
Mm,
breast cancer, it is not a failure to have been stressed before your breast cancer diagnosis.
mm, mm,
And I often have a woman sit across from me and say, I caused this because I was so stressed out taking care of my elderly dad, or whatever. And I'm like, it is not your fault.
mm. Yes.
It is
Yes.
not your fault.
Nope. Yeah.
And we know that stress contributes to all of the major diseases of aging that we suffer from in our world, right?
Yes.
Heart disease and diabetes and dementia and all of these things have a stress component. And we live this horribly stressful life in general
Mm.
with poor stress management techniques. And women have what I call the accommodation gene. Which the accommodation gene is that inherent sense of having to serve everybody else before you serve yourself.
Wow.
And that, there's some men who have it, but not very many. Like, I have one friend who's male who has it. But it's that ignoring of oneself and one's needs and one's health to take care of the children, take care of the coworkers, take care of the aging parents, take care of the aging siblings, take care of the freaking dog. I
Mm.
mean, it's all the pieces. And women are burned out, they're exhausted. And this is when they get diagnosed with breast cancer. And you know and it's so hard for women, for so many women, to set the boundaries that they need to set in the setting of having breast cancer, even,
Yes.
you
Yes.
know
Truly. And I think you made a really profound statement to me, like it just hit me. It's that, and not to shift gears into all like Eastern medicine world, but when you said that you're so busy taking care of somebody else, one of the things they used to teach us during, training in classical Chinese theory is that the stomach meridian
Mhm.
is stomach one's right underneath the eye. So you could have sinus issues, but if you follow the stomach meridian, it goes down through the throat and down through the chest and into the breast. And one of the main areas they say is not to needle or to pierce the nipple because
Mhm.
it's with the stomach meridian. But the emotion that goes with the stomach
Mhm.
is basically you care for people more than you care for yourself,
Mhm.
not receiving the nourishment, because the energy and the chi that goes down through the stomach is for you to get joy from and actually have some nourishment from. But if you psychologically do not feel joy or get the nutrition out of life, you
Mhm.
actually stagnate the chi around the stomach, and so the energy gets stagnant going through the breast. Now, I'm not saying it
Mhm.
caused it. I'm saying that there is that correlation of your needs are more important than mine. I have to take
Mhm.
care of you and I have to neglect myself. I can't get nourishment out of life. So they always told us, like, if a patient has breast cancer, really clean, help their best. You do your best to help with the stomach radiance, because it is it is really hard to see when individuals, when they live their whole life, care for somebody so much and they put themselves on the back burner. And I think
Mhm.
it's really, I'm going to remember that, because like if you see that a lot with your patients, I'll be more astute to look for it now. But that was a side note on that. I mean, it's really, really astounding that
Yeah.
correlates too,
Yeah. Well, and you mentioned how the stomach meridian goes through the throat, and so many women haven't found their voice, right?
Yes.
And that's a big piece. And I encourage, a lot of what happens, and women who have community
Hmm.
do better in
Mm,
terms of long-term outcomes with breast cancer.
mm,
But sometimes community can be, you know, you're not always getting what you need
yes.
as the
Mm,
woman with breast cancer. And so, that whole concept of love languages,
yes. Yes.
right? The
Hmm.
5 love languages. And, being in relationship with someone who understands what your love language is and theirs, just kind of greases the path, in terms of relation. And I think it works also in the setting of a woman asking her family and her friends and her community, she has to know how she can ask for what she needs and how she can receive what she needs and be clear about that, because
Mm,
she's always going to get the church ladies bringing a casserole, right? but but a casserole might not be, I mean, she's on chemo, right? She might not be able to tolerate a casserole.
mm,
But if she can say, hey, acts of service are, an act of service is my love language. I
mm.
would absolutely adore you if you would come over on Tuesday afternoon and just do my laundry for me, please. You know,
Wow, that's
like
a good point, doctor.
like
Wow.
recognizing what is going to be nourishing. Again, here's this nourishing idea,
Mm,
and women, because we have this accommodation gene, we're often going to say, all right, well, who am I directly related to? That's going to be the person who takes care of me in this process. And that
mm,
person might not be equipped at all to deal with the scenario, right? So
yeah.
this is where, and this is again where I love to get the woman who's just at the beginning of her diagnosis so
Mhm.
that I can help her choose her team, right?
Yes.
Who's going to be on the medical team? Who's going to be on the support team? It might not be the spouse. It might not be the sister. It might not be the best friend as much as the person is your best friend. You might just be like, oh, I know that person's not going to be,
Yeah,
serving my best
totally.
interest,
Mhm.
even though I love them, right? One of the best terms. So I have a best friend whom I adore, and her catchphrase is, I love you, but, right? I love you, but.
I love
And
you, bud.
she's setting a boundary there,
Yep.
right? She loves me, but she's not going to go out to dinner with me at 7 o'clock because she goes to bed around like 5:30 in the afternoon. And, she'll say to me, Laura, I love you, but, right?
That
So, it's developing that self-awareness.
Mhm.
And, you know, you see, as I've seen as a provider, people are able to sort of pull these things together really quickly in the
Mhm.
crisis of breast cancer, right?
Yes.
And a breast cancer diagnosis comes at a woman like a steamroller,
Mm.
and they get sucked into this breast cancer industrial process, or complex, the breast
Yeah.
cancer industrial complex, whoosh, right? They're
Oh,
like, they're pulled, and it's appointment and diagnosis and treatment planning and surgical consult and reconstruction consult and blah 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 blah, and it's like a full-time job really
wow.
fast,
Wow.
right?
Yeah.
And it forces a woman to get clear and then to take action.
Oh, man.
And the more I can support that for someone, the better I think she's going to do, because she's
Mm.
clear in what she's doing and she's listening to her intuition. She's not listening to all the chatter out here,
Wow.
right?
Wow.
Right. So,
Mm.
like, if she needs a donut during, chemo, like, have the donut, but
Mm.
be clear in where you're going and
Mm.
who's
Mm.
along for the ride with you.
Wow. 'Cause that's such good advice, doc. And so it's not just, which foods to avoid or which herbs to take. It's like really look at the people around you. And
Right.
when you're working with these individuals, in their journey, like you talked about the individual that for 20 years after, and you're working with her and you're just, her friend. I can see that in you. Like people see you as a friend. They know that they can depend on you. And I know that has to be a huge effect on the patient with cancer, that knowing that somebody that could be their team. And I think that people out there could be lost, when they're in like you said, the industrial complex of it. And
Mhm.
that's going to make me really look into it and ask some of my patients that have come in with cancers. I'm asking them what their team is like, and
Yeah.
because I'm just a guy that I help clean up the digestion. People say I'm a good cleaner. I like to clean
Yeah.
up like mucus and stuff out of
Yeah.
people. That's what I
Yeah.
do, with
Right.
herbs. And um,
Right.
but it is so important. And so, doctor, like when you see this coming together with integrative oncology, where do you see it going? Like, where do you think, I know it's a huge field, but what is your vision of it in the future? Like, where do you want it to go?
Yeah, where do I want it to go and where it's going to end up, I think are two very different destinations.
Mm, mm,
I have come extremely close in my 20 plus, 23 plus year career to developing a department of integrative oncology. And that for me would be, I mean, that's my dream.
mm,
I mentioned at the beginning of our conversation that I worked as a medical writer at the beginning of my work life. And I actually worked at a very, very large, well known cancer center in Boston
mm,
because I lucked out and I got this as my first job. And, I have an extremely healthy respect for conventional cancer care.
mm,
It is absolutely necessary, right?
mm, mm,
And I have a lot of experience in this conventional world of medicine and language around medicine and philosophy of medicine. But I'm also extremely committed to the naturopathic philosophy, which ultimately is holistic
mm,
and uses lower intervention, lower impact interventions like herbs and nutrition and stress management techniques and acupuncture and all those kinds of things to affect change in a human body. And I think that, ultimately we should have integrative clinics all over because conventional medicine has become so siloed. And I mean, how many specialists does a person end up seeing, right? The
yeah.
cardiologist, the nephrologist, the oncologist, the gynecologist. I'm like, you're one freaking person and it's all related. And, and so we've really lost this holistic sense we've sacrificed holistic medicine for the specialization and the modernization
Mm,
of modern medicine.
mhm,
And, in the last 30 years, I mean, I've been involved in this kind of medicine for going on 30 years. And 30 years ago, I really thought that by now we would have more integration.
mhm,
And in a few places we do, but largely we don't. And it's an ongoing struggle. It's an ongoing struggle and I don't think at least over the next 4 years it's going to get any better.
mm,
Um
mm,
but we'll see how things go. It's just it's we live in this age of dependency on research science,
mm,
which has its pros and cons.
mm.
And we've gotten away from how we can help each other heal
Yes.
on an emotional level, on a psycho emotional level, on a spiritual level.
Mm.
Um, and we've sort of privatized those conversations.
Yes. That's
And I think if we're able to really sit with our own intuitions, be comfortable in community, eat good food, and move our bodies, like
yep.
those are really big pieces to overall health. And the medicines and the herbs, whether it's pharmaceutical medicine or herbal medicine, they ain't going to do anything unless you've got, you know, right mind, right body, right soul,
Mm,
right?
That's well put, Doc. It's
You know,
well put. And I think the listener out there, if you are going through cancers and you are listening to this, it is encouraging because, like you said, you need to have clear mind. And I think that the one thing that I appreciate about you, Dr. James, is that your clearness about how you approach things. You know, I know that every person is different. Everybody has a different route of how you work with them, but your philosophies. And when people come to you, I know that people are going to listen to this and be like, I need to talk to her. I need to talk to her and find out what's going on. Are you out? I know you work with patients. Are you in Seattle still a lot? Or you say you're overseas? Do you still try to see patients? Or, you've been in it for 30 years. What's your
Yeah.
schedule like? Can people
I'm
get a hold of you?
I'm in transition. I will be honest. I have been on sabbatical for the last year, almost
Mm-hmm.
year.
Mm-hmm.
Um, I have been developing various online offerings. I have a small supplement company. I have two unique products for women who either have breast cancer, have had breast cancer, or at high risk for breast
Wow.
cancer. Folks can check those out. Um, and I have a couple of courses online, group courses. The first one's called Facing Your First Year with Breast Cancer, and
Mm-hmm.
it's a
Mm-hmm.
group course. I've put my 23 plus years of clinical experience into learning modules that people can have perpetual access to. And then there's weekly interactions with me in a group setting. And then I have a dear friend and colleague who is a breast cancer survivor. She
Mm.
is a resiliency coach, and she comes into the program twice. And I have my next cohort of that program starting up in April. There's
Cool.
going to be more information about that on my website, which is also under construction right now. But it's all going to be there. It's all there now. It's all going to be there again. It's just going to have a different look. And I also have a survivorship program. So the Facing Your First Year with Breast Cancer is a 10-week program,
Mm-hmm.
but you get all the informational modules that cover all my protocols, all my strategies, all the things you have to think about, all those things. You get those as self-study modules, and then you get the weekly interaction. And then the Healthy Survivorship program is a 5-week program, and I'm
Mm-hmm.
also doing that starting in April.
Wow.
Um, and I'm doing both of those programs twice a year. And I've worked with thousands of people over the years, and I've also raised children, gotten divorced, buried my mother, and
Wow.
managing my father and trying to take care of myself. And it's, doing all the things, right? Spinning all the plates, being everything to everybody. And so my one-to-one interactions are a little bit on hold right now.
No,
Um,
totally.
but coming up later in 2025, I will have that dialed in. And so if your listeners are interested in keeping up with what I'm doing, I have a free newsletter and a blog, and I have a really good time writing about the topics that I pick every month. And try and give resources for people. There are a lot of great nonprofit organizations that can help folks when they're diagnosed with breast cancer. So I've got, I try and make things useful, and I like to write. So there's some good pieces in there for folks if they want to sign up for the newsletter.
That's
That's,
amazing.
that's
And
where all the information goes. But I'm on Instagram. I'm on
that's what I was
Facebook.
going to ask you.
I'll just
What's your Instagram feed so people can know it? Yeah.
Instagram is at Dr. Laura ND. And my Facebook page is Laura James ND Fabno. Fabno is a fellow of the American Board of Naturopathic Oncology, and there are not very many of us.
Yes. I mean, I was looking at that and I said, there's not many. I mean, that's a very unique classification. So I think it behooves anybody out there that's listening that knows anybody that's going through breast cancer that has any relationship to this, and you know that you can be helped. We'll have it in the show notes. We'll have it in the captions. So, Doctor, remember, we'll have that there. Anything you need to give to us to help promote for you, we are here for you, and we really appreciate everything you represent. And I'm so thankful for it. This was such a good combo. I would like to, at one point, if we can, keep in touch. I know you're in the movement, and I understand. I take care of my mom. She's had health issues, and doing this and practice and doing everything, it can be quite the challenge. And doing one-on-ones, it would be very, very hard on your body. So I would like one time for you to come back. I would like to talk about. We didn't get into it as much, but when we talked about, like, even with women's health and having to deal with that and why it's been such a neglected area or where it hasn't been dealt with. So I would eventually, if we could, in your free moments, maybe you could jump back on here with me.
Sure.
Hopefully you like the conversation. I hope it's like
Fun.
it went pretty well.
I love talking about what I'm passionate about. And
Yeah,
this is what I'm passionate about, is
that's
helping
great.
women.
That's great.
Yeah. Is helping
Well,
women.
I know your time's valuable, but I do like to ask like one or two questions. But one of my questions is, what does somebody not know about you? Like, what is a hobby you love to do? I know you love to write, but is there some kind of, hobby or thing you think that, this is what I like to do? This is what you'll find me doing in my off time.
Well, actually, what I really love to do is long distance hiking.
Oh, wow.
But I'm too old to sleep on the ground. So what I do now is I've been there, done that, spent 30 years hiking in the Cascade Mountains in Washington State. What I like to do now, I like to come to Europe and hike from bed and breakfast to bed and breakfast.
That's
and
awesome.
They port your luggage. They make all the reservations and they port your luggage. And
What?
like for a European vacation, it's like a tenth of the price of what you would spend if you went and you stayed in hotels and you did all the touristy stuff. And you get to eat great food. You get to meet interesting people. You get to see how people in that country actually live because you're in smaller places.
Yes.
And you get to move your body all day. And
That is
I
amazing.
absolutely love that. So I've done 2/3 of the West Highland Way in Scotland. It's a 96-mile trail. And I did 52 miles on it because I have like shitty connective tissue and things rip and tear. And so I've had all sorts of injuries. And I've done 83 miles on the Coast to Coast Trail in England, which is a 190-mile trail. So I've done half of that. And I'm doing a big hike in Croatia in the fall. And that's what I want to do. Those are the things that bring me joy, is eating and walking.
No, I mean, hey, eat, pray, love. I'm telling you. No, I'm not joking. This is what I love to hear. So, okay. And one more. Okay.
That was
So
your
you're
one
on the
question,
walk.
right?
I love hearing this. I'm actually going to research this about going for bed and breakfast. I'm not kidding. What's your favorite music? Your favorite song?
Oh, gosh. Favorite song?
Yeah, song, music, anything that you like.
Well, actually, I have to say the music, I think everybody has like one artist that sticks with them through their whole life.
Mm-hmm.
I mean, maybe people do. I do. But I think the music that has not changed for me in the way that I hear it and the way that I internalize it, that's been with me since I was 10 years old,
Mm-hmm.
is Fleetwood Mac.
Wow. Fleetwood Mac. Okay. Hey, no, they have some good guitarists. I mean, I help play in a small band, so I always like know the vibe of the individual. So yeah, Fleetwood Mac. Yeah. Do they? Oh, we'll get into that later. I just like, do they do any small tours or anything anymore? Like,
Not anymore. I mean, Christy McVie died a couple of years ago.
Oh,
Stevie Nicks still tours, but it's good classic music, classic rock, good acoustics, great songwriting. And, I was introduced to it when I was about 10 years old. And that music has been with me through every phase, every emotional change, every aspect of my evolution.
Mm-hmm.
Certainly it dates me, right? I am a child of the 70s.
Oh, stop it.
It's I like all music. I like hip hop. I like classical. I like indie. I like blues.
Mm-hmm.
There's a lot that I like. So
I can tell you like you child like the Renaissance. You like to know many different things. So we're really thankful, and I want everybody out there to look at your courses, your newsletter, and we'll have that on the caption. Our producer will put it on there. And Doc, again, we would like to have you back on again. This was a really great conversation. I hope you have the best time in Germany.
Thank you.
And everybody out there, if you like this kind of content and this kind of information and you need it more, then let us know so we can have the doc back on. We can talk more about what you need to be answered. And we're just grateful again. So for everybody out there from the Ancient Health Podcast, I hope you guys have a great day. Until next time, remember, like and subscribe. That's, gives a thumbs up. Take it easy. Bye.